So a concept that keeps coming up over and over again since we started the semester is we got to know who we're talking to. We got to work with the people that we want to talk to, that we want to communicate to, in order to figure out what is going to best work for them. We can't assume we know what is going to be best for people or what messages are going to come across best to people. We actually have to do the legwork. Okay, and now what this section is about is really understanding our target market, who we are trying to deliver that health message to or get that health communication piece to. And then we want to segment that market in a way that we might, for instance, tailor our message slightly differently, or where we place that message or how we promote that message slightly differently, depending on the different markets that are perhaps within a larger overall target market. Or we might just start with the target market and then section down into one market segment and focus on them entirely. There's different ways to do this. Okay, so your target market, it's a specific group of people who are similar in certain ways. And kind of the easiest way to do a target market is like men versus women, or not versus, but men. I want to work with men instead of women, okay, or children versus older adults. Okay, so that's kind of more of demographics, but perhaps a target market also focuses on people at particular behavior stages. Okay, so for instance, an intervention, a physical activity intervention is going to have to be tailored very differently if you want to get people who don't exercise at all to start exercising compared to those that already exercise. Those are the easiest ones. Getting people that already exercise to exercise more, that's the easy stuff. Getting the people that don't like it and that don't want to, okay, we're going to have our goal is the same, is to increase physical activity. That's the ultimate goal. But the way we kind of approach that is going to be different depending on the behavior, the preferences or needs of that particular group. Okay, and again, it says choosing and understanding and or working with, ideally, your target audience is vital to appropriate health communication. And what's really cool is like a new strategy for health communication these days is social media. And if that's perhaps one of your strategies for being a health promoter, there's lots of ways to engage with your audience and kind of figure out what your audience wants, including asking them via like stories or whatever else. Okay, or polls or whatever else to kind of get a heartbeat of your audience so you can tailor a message to them that is going to be what they actually want, is going to keep them engaged and keep them coming back too. Okay, so the exact marketing mix, the exact 4 Ps that we decide on really is going to depend on our target audience. Okay, so here are kind of some basic stages to get you started. Clearly define your audience. Is it men or women? How old are they? What's maybe their income level? What's their physical activity practices? What's kind of holding them back from these kind of things? And then we might want to go further and understand them a little bit more and segment them into different categories. So maybe our target market is BBK students. Okay, but then we're like, actually, I'm focused more on female BBK students. And actually, I'm focused more on female BBK students who don't currently exercise. Okay, so that would be further segmenting your market down. Okay, and then we want to get to know these people. Like, who are they? What do they do? What kind of media do they use? Where am I going to find them? Okay, what do they do in their leisure time? Are they playing video games? Is that why they're not exercising? Are they watching Netflix? Is that why they're not exercising? Okay, and what kind of values do they have as well? And the language spoken. And actually, you might see that in certain cultures, physical activity is more common than in other cultures. And maybe those cultures speak a specific language, so maybe I want to target the messages using those specific languages. Okay? So, like I said, once we have kind of a general idea of who we want to work with, let's go deeper. Let's like actually kind of segment them a little bit more and then figure out how we tailor our marketing or our messaging towards these different groups. And like I said, we can segment our market in different ways. And I'll just go over some of these to clarify over the next few slides. Okay, so kind of an easy way to segment your market is geographically. And you'll actually notice that Coca-Cola is actually a really good example of a company that is going to give very different messages depending on where you are in the world. Okay, so a Coca-Cola ad in Colombia is going to be very different than a Coca-Cola ad in Vancouver, okay, or in the United States. Okay, they target it differently based on the geographic segment. Okay, so even if you're doing running Facebook ads, one of the things you do when you run a Facebook ad is you pick the location of the people that you want to target. Okay, so, and maybe your target is the world, but that's going to require still kind of tailoring within that global market towards the sub-markets within it and how to best approach those sub-markets. Okay, again, we can look at demographics, we can look at age, sex, marital status, income, if we're trying to market something that is going to require large financial investment. So for instance, if we're trying to market coming to a particular gym or health club or whatever, depending on the cost of that health club, we might have to change how we actually market it, okay? Psychographic segments, these are kind of the most interesting to me. These are about people's values or beliefs or attitudes. So for instance, if I'm trying to market not smoking, there are people, so let's say you're trying to market not smoking and you have a message that's like, smoking will kill you, smoking's bad for you, only bad people smoke. There are some people that are like, well, that's kind of for me then. I'm a rebel. I'm a risk taker. You're going to have a different message for risk takers compared to for people that are overly cautious. And you want to think about those a little bit more because our values often dictate the types of products we buy as well. Okay, are they rebellious? Are they traditional? How we market these things are going to depend on that. So for instance, if I want to get people to eat more healthy food, if they're traditional in nature, maybe I'll talk about how this is really about getting back to the land and getting back to our previous values of simplicity. Okay, if we're trying to eat better and someone's rebellious, I'll be like, well, it's actually rebellious to be a vegan these days or whatever. Okay, so again, how I market it is going to be different depending on the psychographic segment, right? The values, beliefs, and attitudes of this group that I'm working with, and I have to figure these things out. Okay. So values, just to give a little bit more definition of that, these are principles or convictions and internal beliefs that people adopt in their daily lives. So our values really influence kind of everything else. Okay, so values, to give you examples of values: honesty, excellence, trust, growth, achievement, accountability. So again, if we actually know the values of a target market, that's going to influence how we send that message. So for instance, I see a lot of physical activity marketing that's really like, go get it, win the day, crush it, kind of that kind of messaging. And I'm going to tell you, that would not work for me. I don't want to crush it. I don't want to win the day. I want to be healthy. I have different values. My values are less competitive. For competitive people, we're going to have a different messaging than for people that are just like trying to live a good life, that are just about maybe more the overall balance and quality of their lives. Okay, so we have to understand that when we're trying to market something. Okay. So we also might want to look at, like we talked about this before, like where are people already at in that behavior? What are their current habits? What are their current barriers? What is their stage of change right now? And I know that we haven't talked about this yet. We're going to talk about it later when we get to the stages of change model. There are people at various levels of change for a particular behavior. Someone in pre-contemplation, this is the person that's like, I don't like exercise. I don't want to do it. Leave me alone. And the contemplation is the people that are like, oh yeah, I know I should exercise more. I get it. Yeah, all right. But they haven't started. Okay, preparation are people, okay, I'm going to do it. I'm going to start exercising more. Okay, I don't know how to do it. I got to make a plan. Okay, and then there's people that are already exercising. Okay, or people that are in maintenance, or people that have relapsed to one of the previous stages. Okay, and the messaging again is going to depend on these things. Okay, and another way to potentially segment a market is by their current lifestyles. Okay, so what engages them most? How do they spend their money? How do they socialize? Where do they socialize? These are some other questions that we might want to ask ourselves. Okay, now that's a lot to consider. And I don't expect you to especially at our levels, don't have to blow your mind by trying to think of all of these things all the time. every aspect of that, but it really is like breaking it down a little bit more. I have this overall market, and now I'm trying to understand them. How much money do they make? Are they male or female? How old are they? Right? What do they like to do? What's their current status? What kind of values do they have? You know, some of the things that we want to think about so we can tailor the appropriate messaging and marketing to these people. Okay, so again, yeah, we want to tailor messages different to different market segments, and they're going to respond differently. If we have a bunch of different campaign segments, then our different types of markets are going to respond a bit differently to each of those. Okay, and ideally we have lots of different strategies and a big kind of global strategy to help us really get across to more people. So something else, once you have kind of figured out just like who, that's our target market, is who are they? What are they about? What are they like? Okay, and then some things to consider beyond that is what kind of media do they use? How do they communicate with each other? Again, what languages do they speak? Okay, then their overall values. So this is again a little bit more of that segmentation. And I think this important line here, don't guess, ideally. Okay, get to know them. Do surveys. Do Instagram, like ask me questions on your stories. Get to know these people. So again, you can tailor the right intervention. And we have to be careful because we might assume that all middle-aged Black women are a certain way, but do we actually know middle-aged Black women, or are we just guessing what they're like? And if we're guessing what they're like, we might be acting a little bit in a stereotypical way, and we definitely do not want to do that. Okay, so some of the stages to get a little bit more specific. So identify those potential target audience, ideally with kind of like getting to know them, looking at the research, looking at what the research says about them. Okay, so what do you know about them already? Again, we're going to do some market research on this, especially if this is a larger campaign. Look at what the literature says, their demographics, what kind of services do they use? Do we need to know anything else? That's kind of the annoying part, is like, do we have to do more research? Is the research already out there? And with market stuff, there's often a lot of research out there about who these people are. Okay, so market literature, like like regular marketing literature, is sometimes a good place to go to kind of understand our target group more. Okay, and then once you've done all this, is like, okay, is what I want to do actually feasible? And do I need to like just start small, or do I want to start larger? How much money do I have? Is all of this work that I'm putting in actually going to make a difference? I know, there's a lot to think about. Okay, so start small, but the main messages I want to get across here is you have to think beyond, I'm just going to get this message across. You really have to understand who you're sending this message to as best as possible in order to be able to tailor it appropriately so it gets the meaning into their head, that inception into their head that we want to get that meaning into, and also a meaning that they want to get into their head too. Okay, so for instance, as an example of a social marketing research process, so that was done in Australia. So they were trying to figure out how to reduce drug driving. Sorry, not drinking and driving, drugging and driving. So like smoking pot and driving, or being high on coke and driving, you know, and how do we stop that? And what they found, I love this title here, at least I'm not drunk driving. So that's a value that they had. They found by doing market research that they're like, well, it's not that big of a deal, you know, like, so maybe for them, it would be one of the marketing strategies I would do, or messaging strategies, is like, actually, it is a big deal. Here are the amount of deaths due to drug driving. So maybe it would be more of like an education type strategy if they think that it's not a big deal. Okay. So this study also found that young people were not aware of the effects of drugs on driving. They also had low perceptions of risk, right? And they felt that there were actually even potential benefits to drug driving, okay? And substantial barriers to like taking the bus or public transit. Okay, so knowing this is like, okay, so maybe I focus on a public transit strategy, and maybe I like make it like how easy and fun, and like you get to meet people. Maybe you'll meet like, you know, someone you'll end up dating on the bus or on the C bus or whatever. Okay, so again, by knowing their values, then we can start with our messaging a little bit more. Okay, So another way to, I know there's so much ways to talk about your target market is to consider the acronym TARPAIR. Okay, so to figure out which target market to target, now that you've done all this stuff, it's taken you weeks, months, years, and you have all this information about this huge target market that you segmented in different segments, be like, which do I actually work with? Okay, so, and honestly, you can pick any of these things. Okay, so maybe you want to get across to the maximum amount of people. I want the maximum amount of people to exercise, so I'm going to target the market segment that has the most people in it. Okay, maybe I want to target the people that have the highest risk if they don't engage in that behavior. So for instance, maybe I want to target older individuals who are physically inactive because their risk of getting disease is so much higher. Okay, maybe I want to target, maybe I just want to go the easy route, like who's the easiest to get this message across to? Who are the most easily persuadable? And often with physical activity, it's people that are already being active. Okay, we might want to look at which group is most accessible, which one can I easily get my message to? So for instance, if you already have a social media following, maybe, well, it's just like, well, I'll just go with that audience because I already have that audience. They're easy and they're easy to persuade too because they like me and they identify with me. Okay, resources required, like maybe one intervention's cheaper, one target group is cheaper to work with compared to another target group. And then I like this E because I think it's important to say that. So there might be bigger groups, there might be groups that are more persuadable, there might be groups that are more accessible, but that sometimes leaves some people just like without any targeting whatsoever, and they're just kind of left out on their own. Okay, and this might be groups that are maybe hard to target. Maybe it's indigenous individuals living in remote communities. Well, they're too far away, there's not that many of them, they're not that persuadable, so I'm just not going to focus on them. But maybe they need it the most, you know? So these are things we can think about when we're making our overall assessment of what our target market is, who they are, what they do, what their values are, and which one, and once I've segmented them, which one makes the most sense to work with.